The shutdown, which I want to talk to you about, you've been writing a lot about, is ostensibly about the Affordable Care Act. But how is the Affordable Care Act doing? It's not shut down, is it?
Well, it's not shut down. It may be here to stay. A lot depends on how these exchanges get fixed online because people are having a lot of trouble signing up. But that's the bad news. The good news is a lot of people really seem to want this product.
Well, that started a week ago tomorrow, October 1, when the exchanges were available. And by then, the law had already been, the law of Obamacare, the law of the land for 3 years, right?
Right.
How was it going before even the health exchanges kicked in? Do we know?
Well, I mean, we know that a lot of people don't really understand it or know what's in it.
But were people using it? Were they taking advantage of it?
They were, whether they knew it or not. I think people who had children in their 20s who didn't have health insurance knew that they were able to keep their kids on their plan.
So that's one good thing, right?
People who were getting preventive care for much cheaper or for free probably didn't realize it was because of Obamacare.
But that had kicked in also.
Right. And, there were people who have pre-existing conditions who knew that eventually they were going to be able to get coverage. So, I mean, there's a lot.
Kids who had pre-existing conditions could already get coverage,
right? So parents of children, sick children
And
knew.
didn't I read also that overall the growth in the cost of medical care had slowed down, hadn't reversed, I guess. But
that's true, although there's some dispute over, the president takes credit for that slowdown, but a lot of experts say it has more to do with recession and other factors.
Mm-hmm.
So that's not yet known. That's the big thing about this law. It's not yet known. But one of the things that people really miss is that about 7 to 11% of the country says it doesn't like the law because they want single payer or a public option.
Right.
Not because it's a government takeover, because they want more of a government takeover. So the opposition is overstated to some degree.
So it was relatively successful up till October 1. And now let's get to, so the exchanges kick in, and there was a huge amount of interest, right?
I think that everyone was shocked.
How many?
Well, in the first couple of days, there were more than 8 million people on the federal exchange, which serves 36 states. So, there's a huge amount of interest. And I think, one of the things that's going on here, and the governor of Kentucky, Steve Beshear, gets at this sometimes, is that if people don't have health insurance, they're not going to tell you that. It's kind of embarrassing. It means you're not middle class. So, there's this huge rush of people to the exchange to get health insurance. Maybe they'll never tell their friends that this is what they're doing. But that there's obviously a need out there.
Yeah. And now there were some problems with the first of all, before we get to that, I have not, John Yarmuth from Kentucky, congressman, was on our show earlier this morning, and he said and Kentucky's got a good plan, I understand, and they've done a good job of getting their site up. He said that they had 100,000 people in the first couple of days and 8,000 signed up. So that's the first number I've heard of actually people not looking, which is important because you look first before you buy anything. Have we heard on the national level how many people have signed up yet?
Well, we actually don't have numbers yet because the feds don't want to give them yet.
Right.
Now, all this is kind of, all of this is really premature in any case because people have until December 15th to sign up for January 1st coverage. They have until March to sign up without getting penalties. So, in Massachusetts, which is the only example we have of this, people waited till the last minute to sign up.
Yeah. Oh, they did?
It was the end of December.
All right. Now, the other news that we heard about the exchanges, of course, is when so many people went to the site, they had some glitches, as we say. On Saturday Night Live, this weekend, they did a little rundown on the winners and the losers in the government shutdown, apropos of what we're talking about.
Loser, the Obamacare website, which had technical issues all week because of too much web traffic. You can't campaign on the fact that millions don't have health care and then be surprised that millions don't have health care. How could you not be ready? That's like 1-800-Flowers getting caught off guard by Valentine's Day.
It really is, isn't it? I mean, it's a pretty embarrassing that
it's
they had
embarrassing. It really is. I mean, these things are so complicated, and they're doing so many more states than they thought they would do, and they had so much more traffic than they thought they would have. It was kind of this, I hate to use this cliche, but the perfect storm of a mess. And, I think that some people thought they were going to make a point by signing up on day one to show their support for it, and that may be backfiring.
I know. I mean, it's just sad that it had to happen to, because it gives the opposition that much more ammunition. But we were saying here, it's like ProFlowers, to use the Saturday Night Live thing, getting ready for building up to Mother's Day or Christmas and doing or Valentine's and doing this huge advertising campaign, right?
Yeah.
And then their site crashes. I mean,
I know, it's crazy. It's crazy, but people who need health insurance are going to keep trying to get health insurance. So I think that, if it were me, I'd say, let's stop the advertising right now, stop the campaigns, don't have the celebrities tweeting, wait a month or two.
But they shut it down over this past weekend. They shut it down to
upgrade it.
To upgrade it.
Yeah.
So we'll see how it.
Yeah. I mean, I think they ought to do big campaigns as deadlines approach.
But I would think, though, that what my takeaway from this is, from the number of people who went to the site, that this is going to work.